Neil Seymour. I'm the Vice Chairman of Surgery at the Bay State Medical Center of Springfield, Massachusetts. And I'm the Medical Director of the Bay State Simulation Center at Goldberg Surgical Skills Laboratory. I've been there since 2003, and I've been involved in simulation training since the late 1990s. It's been a long road, been doing a lot of different things during that period of time. And this is my first SUN meeting. I think it's very valuable. Well, I think as an organization, it seems to be valuable because they're tied in by a common set of equipment usage, and I think that the meeting itself is very educationally valuable. Focuses on things that I think speak to the real needs of simulation educators. Well, I've been invited to sit on a panel and to discuss rolling out simulation center services. Perspective I've been asked to take is that of a hospital-based simulation center director. And in that capacity, it would be different than someone, say, who has been in charge of a simulation center established at a nursing school, or a freestanding simulation center that serves a specific service like EMS. So that perspective is valuable on a panel like that. I think that if you look at the education needs within an institution like an acute care hospital and all the different learner groups that might actually be served by a center, it's quite different than it would be for example, a medical school simulation center or a nursing school simulation center. Although it's possible for a nursing school to exist with other schools, or respiratory therapy, allied health professions, PA schools, within a university, and maybe they might share some educational resources like a simulation center. Once it's established in an acute care hospital, and at least in our case where it's an integrated healthcare system, we have to service the educational needs of lots of different users, including nurses in practice, students from medical schools, nursing schools, PA schools, who are at the clinical site, perhaps they're later in their education, now they have to actually experience their actual clinical learning. When we do simulation-based education for those learners, it's different than it would be if they were at the onset of their education, say when they're doing their classwork-based education. In addition to that, we have undergraduate medical education for clinical clerks, postgraduate residency education. If the hospital is a clinical training site for residents, they have very specific simulation education needs. In some cases, that is mandated by up to the national level. And of course, you have all the people who are doing the clinical work in the hospital, who are working in the various units, and they need to have the educational experience of dealing with high acuity care, learning in alignment with the institution's patient safety mission. I mean, all these things have to get done, and the Simulation Center aligns itself with the institutional education mission by offering very specific educational products that speak to the needs that are unique to the hospital. So I think it is a perspective that is different than it is for the other panelists.